Welcome to Eat for Life Nutritional Therapy. I'm Samantha Gilbert, founder of Eat for Life. I'm a nutritional therapy counselor specializing in a functional nutrition approach to healing Pyrrole disorder. Pyrrole disorder, also called Pyroluria, occurs when a biochemical abnormality causes the body to overproduce Pyrrole molecules. These molecules are continuously excreted in urine as normal byproducts of hemoglobin synthesis and other bodily processes. For the average healthy person, this isn't a problem. However, for someone with Pyrrole disorder, these molecules bind to zinc and vitamin B6 and carry them out through urine before the body can properly absorb them. This leads to nutrient deficiencies and severe oxidative stress. Zinc and vitamin B6 are essential for neurotransmitter production, a healthy immune system, and maintaining intellectual function, mood, and memory. Pyroluria is a mood and stress disorder that is often genetically inherited. I almost always see it in families with a long history of alcoholism and depression, coupled with anger and rage. Northern European populations, particularly the Irish, Welsh, English, and Scandinavian Nordic peoples with light features such as blonde or red hair and blue or green eyes, are most affected by Pyrrole disorder. In fact, Irish drinking stereotypes and fiery redhead jokes all have their roots in pyroluria. However, it can affect anyone of any age. Symptoms are typically most evident in toddlers who present with the terrible twos and teenagers who haven't yet learned how to cope with the behaviors this disorder creates. Pyrrole disorder can also be acquired during acute stress, illness, injury, and trauma because the body rapidly depletes zinc, vitamin B6, and other vital nutrients during these periods. Pyroluric individuals tend to be very intense people with an inability to tolerate even small amounts of stress. When life stresses become too overwhelming, high irritability and extreme temper often result. Most of my clients with this disorder do not like to eat breakfast because low appetite and morning nausea are a big problem. They tend to be night owls because productivity increases when the sun goes down. Many are sensitive to light, thus the increased energy at dusk, odors, sounds, including misophonia, and textures, and often suffer from frequent infections. Depression, high anxiety, blood sugar imbalance, memory problems, lack of dream recall, white spots on the nails, attention deficits, fear-based tendencies, and phobias are also hallmarks of this disorder. Rapid cycling bipolar disorder is often associated with extremely high levels of pyroles in the urine. In children, I see a lot of histrionic behavior and severe temper control problems. They usually struggle to fall asleep and have difficulty paying attention. Most have been diagnosed with a learning disorder, autism, bipolar disorder, ADHD, and/or a behavioral disorder, including oppositional defiant disorder and disruptive mood dysregulation disorder. They also tend to be late bloomers, often starting puberty after their peers. I also see frequent ear, nose, and throat infections, along with digestive issues, food intolerance, and overall pickiness about food. Most of them are super sweet kids who show a high degree of remorse after a meltdown. Your child may also report spleen pain or a side stitch, especially after physical activity. And many parents are alarmed by stretch marks in unusual places. Again, these symptoms are all part of pyroluria. In females, I commonly see menstrual cycle irregularities such as lack of menstruation, painful and heavy periods, PMS, and PMDD. Vitamin B6 is critical for a healthy functioning menstrual cycle, and zinc is needed to create hormones and neurotransmitters responsible for healthy cycle balance. When zinc is low, copper tends to be high, or there is an imbalance between them, which can increase estrogen and create an imbalance among other sex hormones such as progesterone and testosterone. Another feature of pyroluria is a deficiency in the arachidonic acid pathway. Arachidonic acid is a polyunsaturated omega-6 fatty acid critical for brain function, normal growth, and development. While omega-3 fatty acids are widely recognized for their benefits, pyroluria individuals already have adequate omega-3s but are severely deficient in arachidonic acid. This is why they tend to worsen on fish oil supplements. The GABA pathway is also impaired in pyroluria, which explains why alcohol often has a calming effect for those with this condition. I created my Pyroluria cookbook to help people understand how pyrrole disorder impacts the brain and body and provide nutritional therapy support for individuals struggling with this condition. Now, before I close, I want you to understand the essential role zinc and vitamin B6 play in brain function. Zinc proteins in the brain combat oxidative free radicals that could destroy brain cells and alter neurotransmitter levels. Zinc is required to convert dietary B6 into its active form P5P, which is necessary for producing serotonin, dopamine, GABA, a neurotransmitter that reduces nerve cell activity, and other neurotransmitters. Zinc also plays a unique role in activating and inhibiting NMDA receptors, which are essential for good mental health. NMDA is an amino acid derivative very similar to glutamate, an extremely excitatory neurotransmitter. Vitamin B6 in the form of P5P is required for synthesizing dopamine and GABA in the brain. A genetic or acquired B6 deficiency can result in abnormally low levels of these essential neurotransmitters, leading to problems including ADHD, depression, anxiety, and sleep disorders. Beyond neurotransmitter production, vitamin B6 is involved in more than 80 biochemical reactions in the body. A deficiency can also produce physical symptoms, including nervousness, insomnia, nausea, and muscle weakness. In my clinic, I approach pyroluria from a functional, holistic perspective. This includes appropriate lab work and a comprehensive plan designed to support mood and memory, nutrient status, especially zinc and vitamin B6, as well as balanced blood sugar, immune function, and gut health. I provide personalized guidance and collaborate with your medical care team when needed. My approach gives you clarity on how pyrrole disorder may be causing your symptoms, creates stability, and shows progress over time, all with a customized plan based on your unique needs. So if you're struggling with many of the symptoms associated with pyroluria, I encourage you to book a free discovery call with me to see how I can help you and if we're a good fit.